Hey everyone, and welcome. Chances are, somewhere in your medicine cabinet, you've got a little box, probably says Benadryl on it. It's the go-to for bug bites, surprise hives, or when you just can't get to sleep. But what is this stuff really? How does it actually work its magic? Well, in this explainer, we're going to pull back the curtain on it.
Yep, we're talking about that little pink pill. We're going to look past the brand name and get right into the science of the active ingredient inside, a little thing called diphenhydramine. We'll find out what it's really doing inside your body and why it has such a huge range of effects, both the ones we want and the ones we don't.
So here's our game plan for today. We'll start with the basics. Then we'll meet the little troublemaker behind your allergies. After that, we'll see how diphenhydramine actually fights back, explore all the other jobs it has, and, this is super important, we'll finish up with a user's guide to the risks.
All right, Section 1. Let's start by making sure we're all on the same page about what we're actually talking about here.
So most of us just call it Benadryl, right? But that's just the trade name, like Kleenex or Xerox. The real star of the show, the chemical compound that's doing all the heavy lifting, is called diphenhydramine. And that's the name we're going to be focusing on for the rest of this deep dive.
Okay, so to understand how our hero, diphenhydramine, works, we first have to meet the villain of the story. And that villain is a tiny little chemical called histamine.
The easiest way to think about histamine is like your body's ridiculously over-the-top security system. The second it thinks there's an intruder, like pollen or dust or a bee sting, it pulls the fire alarm. And that alarm is what causes all those classic allergy symptoms. The itchy eyes, the runny nose, the swelling. Yep, that's all histamine's fault.
So this is the whole chain reaction, right here. It's pretty simple. Step 1, the allergen gets in. Step 2, your body freaks out and just dumps a ton of histamine into your system. And step 3, that histamine runs around causing all the symptoms that make you feel awful. So the logic here is pretty clear, right? If you want to stop the symptoms, you have to stop the histamine. And that leads us perfectly into our next section. How in the world does diphenhydramine shut down that histamine alarm system? All right, let's pop the hood and see what's going on under there.
So diphenhydramine has a very specific job title. It's a first-generation H1 antihistamine. Now that sounds complicated, but the H1 part is the key. That tells us exactly what it's built to do.
Think of it like a lock and key. Your body has these little molecular locks on its cells called receptors. Histamine is the key that fits perfectly into the H1 locks, which are all over your airways and blood vessels. When histamine turns that key, bam, allergy symptoms. So what does diphenhydramine do? It comes along and basically puts glue in the H1 lock. It blocks it, so histamine can't get in and turn the key. Simple as that. It doesn't really bother with the H2 locks, which are mostly busy dealing with stomach acid.
And what does this mean for you, practically speaking? Well, after you take it, you're going to feel it working at full strength somewhere between 1 and 3 hours. And that sweet, sweet relief should last for a good 6 to 12 hours.
Now here's where things get even more interesting. It turns out diphenhydramine is kind of a Swiss Army knife. It's used for way more than just a case of the sniffles.
I mean, sure, we all know it's the go-to for allergic reactions and sinus problems. But check this out. It's also used to treat nausea and vomiting and to help with these things called acute dystonic reactions, which are these really unpleasant muscle spasms sometimes caused by other drugs. It can even be used in a hospital to help calm down an agitated patient. It's an incredibly versatile medicine.
And this is absolutely critical. In a case of anaphylaxis, that's a severe life-threatening allergic reaction, diphenhydramine plays a huge supporting role. Now, to be clear, the first-line life-saving drug is always epinephrine, like from an EpiPen. But right after that, diphenhydramine is often given to help get all those histamine-related symptoms under control. Okay, we've talked about how powerful this drug is, but with great power comes great responsibility. So this next part is all about understanding the risks and knowing how to use this stuff safely. To put it bluntly, is it always safe? The short answer is a definite no. Like any medicine that actually works, it has potential downsides and side effects that you really, really need to know about.
So who needs to be extra careful? Well, this isn't a complete list, but some big ones are newborns and nursing moms, people with a specific kind of glaucoma, and anyone taking a certain type of antidepressant called an MAOI. And this is a big one, people with breathing issues like asthma need to be really cautious.
This slide shows a really important difference: side effects versus drug interactions. The number one side effect, the one everyone knows, is drowsiness. But that drowsiness can become dangerously strong if you mix it with other things that slow down your brain, like alcohol or sleeping pills. That's an interaction. Other side effects include stuff like dry mouth, and weirdly, in some kids it can cause the exact opposite of drowsiness. It can make them hyper.
And that brings us to a hard and fast rule: the dosage. For a grown-up, the absolute maximum you should take in a single dose is 50 milligrams, period. That is a critical safety number.
And for a child, you slice that number in half. The max single pediatric dose is 25 milligrams. It is so important to respect that difference.
I really want to end this section with a direct quote from the clinical literature because it's just that important. Use cautiously in patients with CNS depression or lower respiratory tract diseases such as asthma. Remember how it can thicken up secretions in your airways? Well, for someone with asthma, that can be a really serious problem.
So there you have it. We've gone from a simple pink pill to a complex chemical tool. We've seen how it works, all the different things it's used for, and the very real risks that come with it. You've got the knowledge now, so the only question left is, how will you use it wisely? Thanks so much for watching.